Dr. Angela Cooke-Jackson to be our speaker today as part of the CHRC virtual seminar series. We've done this a bunch, like in the past 2 years or so. Each time we feature a emerging or eminent, well-established health or I think we're trying to cover risk scholars in general that include health, environment, risk, and crisis in general. Under the same umbrella, we try to feature scholars with different specializing in different methodologies, focusing on different diverse topics. So we're very fortunate today to have Dr. Cooke-Jackson to speak to us. And Dr. Cooke-Jackson's expertise is in health communication and behavioral science. And she uses very uniquely community-based participatory research and media literacy to help communities curate and design innovative practical applications for sustainable change. She's the co-director of the Intimate Communication Lab, and she envisions her research at the nexus of culture, health disparities, and marginalized populations. Her current scholarship incorporates intimacy and reproductive health to advance agency among underserved and marginalized people of color and gender minorities. She has worked extensively with memorable messages to construct a theory and build research that address health outcomes, especially as it relates to sexual health. She has extensive international research experience, and she's been traveling to Australia, Italy, Peru, and Hong Kong. And her travels to Australia were most enriching because they strengthen her understanding of the similar health disparities among Indigenous Aboriginals and the Torres Strait Islander and people of color in the United States. Dr. Cooke-Jackson's research has appeared in numerous edited books and leading journals, and she also has a co-authored textbook entitled Communicating Intimate Health. And I should also mention that Dr. Cooke-Jackson is a senior editor of our flagship journal, Health Communication, where I also serve as senior editor. So it's really great to have my co-editors here. And the presentation today, the title of the talk today is Risk Communication, Engaging Community-Based Participatory Design Models to Increase Awareness and Partnership within underrepresented Black and Brown communities. So Dr. Cooke-Jackson will speak for about 40 to 45 minutes, and then that will be followed by a Q&A session. So during the talk, we're not taking questions, but if you have questions, feel free to type them into the chat. And at the end of the presentation, I'll be monitor the chat and ask those questions maybe on your behalf and to Dr. Cooke-Jackson. Okay, so Dr. Cooke-Jackson, please go ahead and share your slides. I'm making sure that it works.
And can everybody hear me okay?
Yes, we can.
Yes,
I can hear you clearly. So go ahead, do your thing.
Thank you so much. It's so good to be with all of you today. I am excited to talk to you a little bit about my research. I'm a really practical person. I am very simplistic a lot of times when I think about research, and I'll talk a little bit more about how I arrive in that space and why. So as we go through, I really do want to share with you a little bit about how I think about risk communication. And then I want to show you some of the work that I've done because I think that applied piece and you being able to see the research that I've done and how I've actually used community-based participatory design models will really help you understand the way that I think about the scholarship that I do. It's really exciting to have a couple of good people here in the conversation as well. And I know that I think my sister, my older sister, and then my my sister's twin brother have been able to join, and I'm going to talk about them a little bit as we move into the conversation. I want to start by asking you a really important question. Which is your favorite chocolate? If you had to pick a chocolate, if you don't do chocolate at all, that's fine. But if you had to pick a chocolate, which one is it? Are you a lover of dark chocolate? Or maybe you're a lover of a little mix of like a dark chocolate with a little chili in it? Or are you somebody that really, really enjoys milk chocolate? Or are you a white chocolate person? Like when you sit down to watch a good show and you want that chocolate bar beside you, which one is it? And so I don't know if it's enabled. Are you guys all able to see my screen okay still? Are you able to put a little commentary in and let me know real quick, like which one are you? You can just write it in the little box and I'll look at that a little bit later. But what's the value of that question? Thank you. I see some of you adding that to the chat. Why is that question valuable? Here's why. Here's why I'm asking you which chocolate is your favorite. For me, I'm a dark chocolate person. I could walk back to my refrigerator right now and I'll pull out a bar of dark chocolate that's in the freezer because it tastes really good to me when I put it in the freezer and it's cold. That is my jam, dark chocolate. Sometimes I kind of play around with the dark chocolate with the chilies in it. It's not my favorite, but I like it because it has a little bit of a spice in the taste. And I really don't care too much for milk chocolate, and I really don't care for white chocolate. I had a bad experience as a kid with a white chocolate Easter bunny when I was little. My stepdad told me, don't eat the whole thing. I ate the whole thing and I got really sick. And since that time in my life, that event has turned me off to white chocolate. But every now and again, my husband will make a cookie with white chocolate chips in it, and I'll eat that cookie because it tastes really good. So why this, what does chocolate have to do with risk communication, and why am I bringing that into the conversation? Well, I'm bringing it into the conversation because for me, when I think about the research that I do and what I'm really passionate about, where I see my vision, I oftentimes equate it to this ideal of it being that thing that I really love, and that's dark chocolate. And so for me, dark chocolate is symbolic of being a naturalistic or an interpretive research scholar. I love it. I have a natural proclivity to it. When I put it in my mouth and the way that it melts, and especially this particular hue dark chocolate bar, it just takes me to a place of ecstasy. And I want you to begin, as we take this journey, to think about that concept, that analogy, that some of you are white chocolate people. Your white chocolate might be the thing that really pumps you up. And it might be that that white chocolate is the chocolate that is the empirical approach to doing research. So when you do scholarship, you really love to jump into the data. You love to look at big data sets. You love to see across generalizations of populations across different issues and topics. Some of you are a bit more on the critical approach or critical scholars, and you like milk chocolate. That's your favorite chocolate. And then some of you are dark chocolate people with a little bit of chili in it. You are really adaptable. You like to use a little bit of mixed methods. You might start by using a naturalistic approach to your research, and then you might turn around and add surveys and data collection in an empirical approach manner to help your research be more holistic, more wed together. And that's the approaches that you take. Chocolate is different for each of us. We all like it differently. That's okay. We need chocolate. Dark chocolate, for example, is a part of our endorphins. It sends off this good feeling in our bodies when we have dark chocolate because of the cocoa property of it. So we all need chocolate. We all like chocolate, but we don't all have to like dark chocolate. And we don't all have to like milk chocolate. In the same way, as you think about who you are as a scholar and the research that you're going to do, and for those of you who are newly in scholarship, for those of you who are in your PhD or your undergraduate programs, when you think about the research that you do, it's okay for you to be comfortable with the chocolate. And it's really important, I believe, for you to think about what area is most accessible for you, what feels natural for you. what is the process that you want to do the most? So one of the things that I really am aware of as I think about our process, and I'm going to give you just a little quick classroom lecture before we go too much deeper, is that it took me a long time to understand that I was a naturalistic and interpretive research scholar. It took me multiple classes from the University of Kentucky in my PhD program to finally begin to put the pieces together. And it wasn't until I took a class in another program, which was the College of Medicine, and ended up getting a certification in behavioral sciences, working with Dr. Nancy Schoenberg, that I began to understand who I was as a scholar. But it took me a while to put these different approaches to inquiry together, to understand what their meta-theoretical assumptions are, that these epistemological, or my ways of knowing, especially what embodied me as a person, were a part of why interpretive, and naturalistic research seemed to rise to the top for me, why I wanted to do that. And then it took me a little bit longer to understand that if those were the places that I lived, if my philosophical assumptions tended to lean more towards being an interpretive scholar, that meant I was more likely to be respectful of and engage in qualitative research. And then theoretical phenomena that really hit home with me were theories like grounded theories, or using ethnography or autoethnography, using co-cultural theory, or communication sense making, were all things that seemed to kind of come up to the core for me. And that really started to happen in my academic trajectory as I started to take classes outside of my department. The department that I was in was very qualitative in nature, very quantitative in nature. So a lot of empirical, positivist research scholarship happening in that department. And being able to take a class with Dr. Nancy Schoenberg at the University of Kentucky, and actually have her introduce me to a book called The Handbook of Qualitative Research, in which I read an article called Racialized Discourse and Ethnic Epistemologies by Gloria Lanson Billings. That was the dial that finally turned on. That's when it finally made sense that my dark chocolate was as an interpretive scholar, and that my ways of knowing were ways in which I wanted to approach things through qualitative research. And so I've been on that journey. I've been on that journey as far as trying to develop theory. I've worked on a theory using memorable message construct, worked on theory development with Dr. Valerie Rubinsky, that is called, we call it the theory of memorable messages. And we begin to build context around that, propositions around that to support it, so we could do qualitative data collection and also quantitative data collection. We've written about it if you look at our scholarship 2017, 2021, 2022. But all of that is my research, my dark chocolate coalescing together. And it has taken a lot of time. It's taken a lot of energy. And I wanted to start there, my brief CJ classroom lecture. I wanted to start there by telling you that, but also encouraging, especially those of you who are on the academic pursuit, to give yourself time and to think about the questions that are important to you and be comfortable asking them, asking of the literature if you see yourself in the literature. And if you're not in the research literature that you're reading in your classes, why aren't your people, why aren't the research, the chocolate that you most have an affinity to, why isn't it in it? And then how do you find other resources that help supplement or help you understand who you are on that journey? So these were two pieces that were very formative for me, Dr. Schoenberg and this particular reading. And when I got to read it, the light bulb went off and I was like, that's it, I now get it and I understand it. So what about me? Part of the reason I feel that I'm so immersed and naturally inclined to look at qualitative research and mixed methods is because of the family system that I come out of. I am the youngest of four other siblings, and then I have an additional sibling that is my half sibling. I grew up in a household in which my mother was a dress designer and had her own dress shop, but prior to that, she was a single mom to 5 children. And that experience really manifested in me and who I was and who I have become. So we started off really poor, and my mom made work happen, had jobs, worked in Toledo, Ohio, for example, at LaSalle's as a person who sewed bras. She worked for a really wealthy, affluent family in Toledo, Ohio, and did everything from service to making dresses and gowns for that family. And she did a number of other things. In our society, we might call her a garment maker, but for her, it was her journey to make sure that she made a way for her children. And so one of the pictures that you see on this is Elfrida's Fashion for All Season. Her name in her shop was called Elfrida's Specialty Shop. And these are clothes that she made. And I got to see that happening while I was growing up. My mom had an expectation that all of us had to know how to sew. That even meant my older brother, Benson. And we had to make clothing. And the way that I manifested that was through art and through quilts. So for me, this quilt in the corner is a quilt that I made. And it was just something very natural. Why am I sharing that? Why does that matter? Because who I am is very much stitched into the way that I do research. It's very much a part of the way that I approach the world and that I look at the world. And it's manifested through my artwork. It's manifested through my relationships with family. It's manifested in the things that I ultimately do in the community. And I really feel like there's value in trying to allow for that to have space. And so again, I want to encourage all of you to make sure that you give space to those things that are very much a natural part of who you are. We often get to college and we get into our PhD process, and a lot of times we feel or we believe we're told that we have to put those things away, that we can't bring those things into the classroom. I feel that they're very important and necessary in the classroom, because in turn, what they do is they begin to help you develop the research that you want to do, and they begin to help you find ways to fit into society as a scholar, as a researcher, as an author, as somebody who publishes. And I believe that that's extremely important. So all of these things, as you read them, my proclivity towards looking at sexual health, chronic illnesses, invisible illnesses, especially things for LGBTQ and women of color. All of these are things that have been a manifestation of me. And this is me on my little bicycle when we finally moved from our very poor community into the suburbs. My mom and stepdad brought me a bike and I would go at it. I was liberated. I found excitement and the ability to jump on my bike and just do the things that I wanted to do in this new community. But I also had in the back of my head an understanding of where I had come from and what it meant to finally have access, and that the work that my mom had done very tenaciously and very difficult work, that was the access that gave me the opportunity to go to college to become educated. So today I want to talk to you all a little bit about the definitions that kind of linger around risk and risk communication. I want to give you a little bit of an overview of human-centered communication-based research. And then I want to share some of my experiences in the classroom and the work in the community, as well as the outcomes. And then we'll conclude by looking at some of the guiding resources that I use to put those things together. And then I'll share with you a little bit about the Intimate Comm Lab. So is that good for everybody? Any questions at all? Nope, sorry, Dr. Nan says I can't ask you questions yet. Hold on to them and we'll come back to your questions. So a little bit about me, always trying to turn here. Just a second. There we go. So when I think about risk and crisis communication, I am, again, very simplistic, very pragmatic. When I approach communities, I always try to go in with plain language, simple language, so that they understand what my role is and they understand why we're talking about and or addressing particular things. So it's very natural for me to do that when I'm speaking to others. And so very naturally, when you look at the term risk and you look it up in the dictionary, it just says that it's a situation involving exposure to danger. Right. And so when we look at it from a more technical term, Dr. Vishnawat talks about risk. He's a professor. Most of you probably have seen his research at Harvard T.H. Chan School of Public Health. And he says more formally, as it relates to us in health communication, he says that risk communication is a part of everyday life. It's something we take for granted. To communicate risk effectively, we need to understand who the specific audiences are and the challenges that are likely to face in assessing the risk and acting on them, right? So he gives us a little bit more formal definition of risk and what risk communication is. But one of the things that is really important to highlight here is that he says risk communication is a part of everyday life. And that is very true. I really like this excerpt from O'Shea et al. It's out of an article called Boil Water Advisories as Risk Communication. But I thought that this particular section talks very clearly to what the ideal of risk is, that risk communication is a systematic, interactive, and science-based approach to communicating with diverse audiences and stakeholders in situations that are high concern, high stress, emotionally charged, and or highly controversial. The authors go on to talk about the fact that risk communication is associated with the pre-crisis stage, while crisis communication is associated with the crisis and post-crisis stage. Thus, crisis communication centers around preparing for and reducing, limiting, and responding to threats and harms within the context of given crisis. And the authors go on to talk about the aspect that the scope of risk communication, it's personal in nature, right? And the aim is to help individuals understand how they can reduce their exposure to risk. And when I read the definition from Webster's dictionary, and when I read Dr. Viss's definition of risk, something popped into my head again, my visual, practical, applied person. And that was what I call my popcorn story. There was a point in time in my life, I was very young, my siblings were much older, but they remember this, when one day our mother let us have a popcorn day. All day, we could have popcorn. We could make popcorn for breakfast that day, we could have it for lunch, and we could have it for dinner. And we were elated. And again, I was pretty little, but I remember one recall of the story being told by my siblings, and then also remembering this happen in my life. And we thought as siblings that this was a wonderful thing. But the reality was, as I said, we were poor. We were on public assistance. And my mom was trying to decide whether or not to turn off the electricity or to keep it on. And in doing one, she could turn off the electricity, she could turn off the gas, she could buy groceries. But what she knew was she couldn't do all three because she needed that money to sustain her for a week or two more till she got to the beginning of the month and got her welfare check so that she could buy groceries and pay all of the bills. In her decision, she was thinking about the risk of her children. And in her decision, she was thinking about the crisis on a very layperson's level. And when I think about that, it's really powerful because when I look at communities of color, communities that have been disenfranchised, are marginalized, Black and brown people, poor income, I think about the reality that on the face of it, they understand risk and they understand crisis because they're living in it day to day. So for me as a researcher, having now the privilege to not just think about my own lived experience, but then to move that into the research spaces, I have to be very conscientious of that. And when I move into those research spaces, I'm asking myself intuitively, what do I remember about my experience growing up and about being poor and having to have things given to us, clothes from Goodwill? What do I remember about that? And how is that important? But then how do I also understand what that means for topics like risk communication or crisis communication, especially when then I become that person that gets to go into the community and be present with that. So again, I want to share that with you. I wanted to share my popcorn story with you because I think it's important for us to go to the academic journals, to the scholars who are writing about it, to those who are doing the Center of Risk Communication. It's important for us to go there into those spaces and to do that work. but it is also critical that we on a lay level understand the experiences of our communities so that we can make sure that we give them the best access that they need, and that the voices that they have and what they are inclined to want to have happen in their communities is happening on their behalf. So this is just a quick overview of literature. It is not exhaustive, it's not everything, but I just wanted to give you a little bit of an idea of like what's happening now and a little bit of the literature around risk and community engagement. There are a number of scholars who are starting to put those together and actually do community-based design. So there are 3 pieces on the right or the left of your screen, I believe, that are looking at some of the scholarship that is coming out now on community-based design that is also emphasizing risk communication. On the other side, there's been a lot of controversy around community-based design, and a lot of scholars now are coming to a place of wanting to make sure that it's more centered in the community, that there's not this top-down approach, even in doing community-based participatory design, which is supposed to be for the community. But a lot of scholars are feeling like we're still using a really hardcore top-down approach. And we need to be careful about that, because ultimately this community-based design and human-centered design needs to come from the community's voices and their experiences. So these scholars who are listed underneath community-based design paradigm shifts are some of the scholars who are beginning to work on that. One of them that we've seen really emerge is called Indigenous Participatory Design. And I will share my slides with you, but if you hit on this link, it will actually take you to a participatory design toolkit that is Indigenous centered. So this has taken a lot of work to put together, because in giving it time to breathe, these folks have gone into the Indigenous community with the hopes to make sure that the elders and that the community members that are a part of these Indigenous communities are at the table as they do participatory design. That to say that when we think about how we look at risk communication and design, like I said in the popcorn story, there are some low-level risks that all communities are dealing with. They're dealing with thoughts of paying bills, transportation to work, wage discrepancies, unplanned pregnancies for low-income women. We know that there are middle-level risks that exist, from houselessness to educational access, maternal health equity, and mental health equity. But most of us, if we were to say we were to look at the body of scholarship that is happening with risk communication right now, much of it is looking at things like the COVID pandemic, H1N1, HIV epidemic, Katrina impact, and there are, of course, a number of larger high-risk crises. I want you to think about those not so much as in compartments, but understanding that risk and crisis happen in people's lives on a daily basis, and they deal with them, and they make ends meet, and they make their lives work. And those small level crises, those small level risks, oftentimes become manifestations of the COVID pandemic impacting them being able to pay bills and them ultimately ending up houseless, right? So think about the linearity of that and put those pieces together so that, again, when we approach the community, we are thinking about the stories that the community has. We're thinking about the interest of the community. We're thinking about transparency with the community and what are the realistic approaches that we should have. And then what are our goals and our plans per the community's experiences and what they've divulged to us that we need to have to help us create good community-based programs. And then always, one of my big sticklers is making sure that we are culturally competent, making sure that we are asking of the community who they are, and then making sure before we go into the community that we gain an understanding of that community and who they are, not just because we got it out of a book, but because we had conversations with those people and we understand where they're coming from, right? My brother Benson, Dr. Benson Cooke, has taught me over and over again that history matters. And so for that, I wanted to share with you just 4 pieces of content that I think are really, really important to think about. And I wanted to share those because I want you to understand that histories of people groups are meaningful, and they are critical for defining the spaces that those people groups live in. We have to acknowledge that as research scholars. I count it a privilege to be able to go into communities, to engage with them, to understand them, and to talk with them. But I also understand it is where I came from. But doing that work doesn't mean that I get to go into the community and the community automatically knows that I have had the same lived experiences they have. So we need to make sure that we understand the historical context of the people that we work with when we do community participatory design research, not so that we can pronounce them as Black, Brown, Indigenous people in their communities is incapable, but to understand their lived experiences and to be able to think about the lenses through which their trauma, the injustices that they've experienced, and their marginality have formed their lives, have been a part of who they are. And my little stars are just some folks that I love dearly, that I really have appreciated their research. Levels of Racism, a theoretic framework, and A Gardener's Tale, an important piece. Make sure you get your hands on it and read it. Nadine Burke-Harris has a piece called How Childhood Trauma Affects Health Outcomes Across a Lifespan. And again, shout out to my brother Benson. Dr. Benson Cooke has a piece called Stereotyping, or Creating a Stereotype of a Race as Dangerous, Unintelligent, and Lazy, examining consequences of cultural and psychological conditionings in America. And Dr. Benson Cooke is a psychologist by trade, and works in Washington, D.C. as well at one of the universities there. So I want to quickly get into the value of community-based participatory research design and share with you a little bit about what I've done in the field, so that hopefully we'll have a little time to ask questions about that. Very simply, again, very grassroots, community-based, human-centered participatory research includes these aspects of empathizing, defining issues, problems, dynamics that are happening in communities, ideating with the communities, creating prototypes that might represent what the community needs, testing those prototypes, and then going through an iterative process in which the community is involved, in which you test it, go back to the table, ask if it's working. Testing it includes in the community, actually applying it in the community and seeing if the community finds it, is responsive to it, is able to use it, and if not, going back and tweaking some of those things that might not be working for the community, because again, it belongs to the community. Making sense of human-centered community-based participatory designs means that you should go with a number of objectives. First of all, one objective is to make sure that you honor the community and the individuals that are in the community. The second thing you need to make sure that you're doing, and these are not 1, 2, 3, and in the sense of one is more important than the other. These are all very, very much a part of the process of doing human-centered community-based design. Make sure that you work to remove top-down approaches and or hierarchical approaches. Remember that you're coming into the community and you're helping them co-design something that will be useful for them, but you also have to be careful to ensure that it is from the voices of the community, be that the elders, the youth, a pregnant woman, what do they see as a need for their community that will help them be successful? Additionally, work to suspend judgment and seek to listen openly with the community members. Also, clearly and openly empower different perspectives and outcomes so that you have a really robust effect of what you are attempting to accomplish in the process. And then lastly, work to co-create and collaborate. So this is a space where you're allowing individuals who are directly impacted by the phenomena or technological interventions to play an active role in the design process, in the way that the problems are defined and addressed, and then the impact of the outcome. There's been a big body of research now coming out on able-bodied privilege. And I like the research, and I think it speaks to this ideal that sometimes those who are on the margins, those who might have an invisible illness, those who might have a chronic illness, those who might have an actual physical disability, they might be wheelchair bound, they might not have seeing capacities. These are all things that we also need to include in this process, not just culture and gender, as we are doing community engagement. I always ask myself when I'm invited into the community, who invited me, and how was I invited to the table? Like, what was the role that I was asked to come and participate in? And that helps me to become and always maintain this ideal of what I call being a conscientious research collaborator. I've also put an article on the side that just came out in 2021 by McFarland et al. And in it, they are talking about this idea of community participatory research. And they're looking at it through the lens of clinical trials. So that's a little different than the work that I do. But what I do think is important about that particular piece, which is in Health Communication Journal, is that it offers you a look at 10 years of what's been going on, or 20 years, I'm sorry, of what's been going on in community-based participatory design, particularly for Black and Brown people when it comes to being involved in clinical trials, which is really, really important. So I want to spend the last few minutes, it's about 32 minutes in, I want to spend the last 2 minutes talking a little bit about some of the work that I've done so that you can see what it looks like and you can hear from me. I won't spend a ton of time on it because I really would like to be able to open the floor up or the space up for some Q&A time, but I've had the opportunity to participate in a number of different community-based programs, and these are some of the ones that kind of rise to the surface. One of them is in HIV/AIDS in Los Angeles. The second one is with the family van, or formerly called the Family Health Van. The third one is Community Conversations, Sister to Sister, a Woman's Health Initiative. The fourth one is Peppy Pods and Indigenous Torres Strait Islanders in Maternal Health. And then the last one is Emerson Literacy Education and Empowerment Program, or what I call ELEAP. So the first one was actually done in my class when I first got to Cal State LA. We worked with Dr. Leo Moore, who was at the time, he was an associate medical director and clinical prevention specialist at the Department of Public Health. And we actually brought him into our class to talk about HIV and AIDS prevention and treatment with PrEP. So one of the things that he did was he brought in a variety of other scholars who had expertise and community agencies who had expertise in these areas. And we looked at substance use, Black and Latino MSN, or men who have sex with men, transgendered persons, and Black and Latino cis hetero women. So we looked at those 4 different things. And in the class of about 20 folks, we were broken up into groups of 4. We did basically the practice of community-based design over the course of the 15-week period. We started, as the students in the class started first with understanding what was going on in the research scholarship. What does the literature says? And so each group had to put together an extensive annotated bibliography, because I want folks to understand, and especially if you're at an academic, what's happening in the scholarship around this topic. And again, are you seeing the voices of these people, HIV, prevention, treatment, PrEP, substance use, Black and Latino MSN, transgendered, Black, Latino, cisgen? Are you seeing that in the research literature? And if not, why? And if so, how are they being presented? And then at that point, after finishing our scholarship, we break into groups in which we are going actually into those communities to interview with those people, as well as bringing these different folks into the class to talk to us about HIV and AIDS prevention in these respective communities. And then we begin to do an outline of understanding the landscape of that community, understanding some of the challenges, the interviewing with these partners and collaborating with them. And then the class, together, we start to draw, paint, color, ideals, sketches. What are some of the things that you heard the community speak to? What did they talk about? And then how do we take those and begin to create prototypes for the community that represent what they spoke about? So those prototypes then go back to the community advocates to the other stakeholders in the community before we actually put something together that is cohesive, that would help the community be successful. The outcome for the classes are oftentimes, or this class in particular, what I would call, they can call it a design booklet, they can call it a zine, they can call it a portfolio. They're turning one into me and they're turning one into the partners. And it also is a presentation in which all of these folks come to the class, and each team presents out what they did their research on. So substance use presents out on substance use, and so on and so forth. And it's a beautiful time because my class gets to have an opportunity to talk with the community, but we also get to bring the community into the classroom in partnership and collaboration. So this is one way that community-based participatory design happens, and how I teach it in the classroom. Another experience that I had in community-based participatory design is with the Family Van. The Family Van is located in Boston. You can go on their website and check them out. And it is a mobile van that goes around some of the more low-income, less accessible communities. One of the things that's really profound that we don't often think about when we have all of a sudden access to healthcare, we forget to think about folks who don't have access to healthcare, and that sometimes they're not comfortable coming into a medical environment. They're not comfortable coming into a hospital to seek care for whatever is happening, whether they just need to get checked up for diabetes, or whether they have a full-blown illness. Going to the hospital is not something that they consider is a viable option, and or they don't have the insurance. So the Family Health Van has been extremely instrumental in the Boston communities, going into these low-income communities, oftentimes communities of color, and making sure that people have access to care. And as you can see on the picture, they can get tested, they can actually get HIV/AIDS screening. And one of the goals for me was to work with Jennifer Bennett, who's the taller woman in the picture there in the red shirt, and actually help her think about how to bring young adults, teenagers, onto the Family Van, because those teenagers saw it as something that, you know, my grandma goes there, or my mom went on there to get some help with her medicine, but why would I use it? So one of the things that I was involved with doing is creating content and working with teenagers, which I'll talk a little bit more in eLeap, working with these teenagers to create resources that might bring their peers onto the Family Van, so that their peers would understand that they too could use the Family Van, but they could also see that there was a space in the community that helped them think about topics of sexual health. So this is one of the experiences that I was able to participate in when I lived in Boston, doing sexual health access and awareness among teenagers. Another one that I love dearly is called Community Conversations, Sister to Sister. And it's a women's health initiative that happens in a beauty salon. African-American woman named Erin owns this salon in Cambridge, Massachusetts, a very small community. And they're using the space now to create access and information for the women who come into the salon, and also for their family members to understand about different health issues. So Sister to Sister was created to address barriers to improve health outcomes in the Black community and to empower community members as they navigate the medical system in search of highest quality care for themselves and for their families. And it is a space that has truly been wed in trust and access to information. And one of the things that they do is on a yearly basis, they have a calendar. This is their 2021-22 calendar, in which on the 12th, on October 2021, on November 2021, in December, and then into January, they have different sessions with these women, as you can see, at the beauty salon. Here's the power that they have in this. They actually bring in predominantly African-American community and African-American women. They bring in African-American practitioners, doctors, care providers, social workers to speak to these women about these different health topics. It does a couple of different things, but one of the most powerful things it does is it removes this anxiety of talking to a doctor about medical topics and medical issues. It allows them to have firsthand access to African-American females who are doctors, who are practitioners, who work in social work, who work in mental health, who are psychologists, the whole gamut, to have those conversations with the women who are oftentimes coming to this particular beauty salon. And it's a beautiful space. And part of my role in this space was not so much helping them design it, but helping them think about taking it to the next level. Because at that time, they were an N of one. They were the only beauty salon that was doing work of this nature, but they were struggling to figure out how they made their model something that could be accessible, transferable into other communities, and even how could they get grant funding. So this was a way that I came in to participate with those who were at the salon, who were the key stakeholders in thinking about how do we design things in a way that that can be actually given back to the community and you can get grant access. When I was in Australia, I had the opportunity to work with what is called Peppy Pods and SUDI. They don't call it SIDS there, they call it SUDI, or sudden unexpected death of infants. And in doing that, that was an opportunity, again, to talk with, be a part of Janine Young at the University of Sunshine Coast, Leanne Craigie, to be a part of work that was helping nurses and practitioners in Queensland Aboriginal and Torres Strait Island community think about safe sleeping habits for parents who had newly born children to prevent SUDI. So this was yet another opportunity to engage with them and have conversations within the community and with these women in the picture about how do we create safer sleeping spaces for parents so that we see a lower incident of rates of SUDI. And then last of all, I ran a program at Emerson College where I was formerly employed called the Emerson Literacy Education and Empowerment Project, or ELEAP. It was a peer-to-peer model that I used to actually work with college students, hiring college students. I got a number of grant fundings, and we worked with those college students, trained them, and partnered with the Department of Public Health in doing programs with an organization in the Department of Public Health that is youth-centric called Start Strong. And that happened between 2012 all the way to 2016, with each summer being a time for 3 months of the summer of bringing in these teenagers to Emerson College. Two motivations: one, to make sure that they got access to college and could see what it looked like, and then two, to help train them in media and sexual health literacy so that they could in turn go do peer-to-peer education with their peer friends, their teenage friends. And so this was another beautiful time of engaging. One of the things that's important about this opportunity is it yielded scholarship. It's often hard when you're doing participatory design to do scholarship on it because you're in the field working. But luckily I was able to publish with two of my grad students, one Katie Barnes, another one Abigail Ringwith. I always have a difficult time saying her name. It was also important because it yielded a lot of other content and just engagement in the community. I want to stop pretty soon, so I want to just really quickly go through these last slides. These are resources. Again, I'm very comfortable sharing. A lot of the work that I do sits in the Field Guide of Human-Centered Design and Innovating for People. A counter piece to that, the Field Guide of Equity-Centered Community based design is really centered in decolonizing community-based design. And then just a fun book that I think will enlighten you and give you some insights about how we Americanize the psyche, the mental health of populations around the globe. Is called Crazy Like Us, the Globalization of American Psyche. And then I wanted to show you a couple of other resources that are my publications, one in the Handbook of Health Communication, one coming out in the International Encyclopedia of Health Communication, and a recent publication in Media Literacy, Equity, and Justice called In a Time of Crisis, Who Can We Trust? Again, all centering around this ideal of communities of color, the marginalization of them. So lastly, I want you to think about some of your takeaways, and those are the fact that you have to build trust in the community, that you have to be aware of community knowledge and lean into that and trust the process. And that you yourself in doing community-based design have to be reflexive and have to be competent enough to think about who you are in that process so that you are able to really empower and embolden the community in a way that is healthy. And then finally, you can find a lot of the work that I'm doing in the Intimate Communication Lab. This is a lab that I co-direct with Dr. Valerie Rubinsky. We have faculty affiliates now, one of your own, and Dr. Hintz. And then we also have a number of research associates and partnerships that we've developed. And again, this is an amalgamation of a variety of different folks that I love dearly, I've known for many years, and we've partnered in research in different ways. And we're trying to make sure that we kind of infiltrate the world of scholarship in a unique way, using our diverse perspectives and diverse ways of being as we do the work that we do. And I will end there. You can find me on Twitter, Instagram, and then my email. And Dr. Dan, did I leave us time for some questions and answers?
We do have about 7 minutes. If you could unshare the screen. So I want to see everybody a little bit better. And you guys, if you have any questions, you can just raise your hand or digital hand and I can call you on. And oh, I got a question in the chat as well. You can also put your question in the chat. And it's a good opportunity to ask questions directly to Dr. Cooke-Jackson. If you have a question right now, you can raise your hand. And I have a question from the chat. It's from Ari. Ari said, I have a few of my okay, so I have a few of my undergraduate students joining on this wonderful presentation. Do you have any words of wisdom as they continue their academic journey?
Yeah, I mean, I think first and foremost is I really find value in bending into who you are as a person. As you will hear from those who I mentor, I'm very clear about wanting them to be introspective. So getting to know yourself and feeling confident in what you are and where you come from is an important stepping stone for me in the research that I do. And it's been invaluable for me. And I'm glad that I had a family that that really pushed that notion for me. I think the other part then is beginning, I say this very simply, like as you begin to look at research and get involved in it, I always encourage my students to ask themselves, where are the holes? Where are the holes in the research? When you look at it, what things are missing that you are captivated or interested in? And then how do you ask questions of those holes that you can fill? Because not everybody can do the same thing. Not everybody approaches research the same way, but you naturally have a proclivity that this is what I see as fascinating. So figure out the holes in scholarship that are really important to you, some of the things that are missing, and begin to create research around that is fascinating and interesting. And if you don't find that research happening in the classes, don't be ambitious, go looking for it, go reading. Like I said, I went to the College of Medicine, and that's where I began to find the ways to fill my holes with an anthropologist and a gerontologist, Dr. Schoenberg. So think about it like a journey and like an adventure, and be curious, and lift up every rock and find yourself in the research and figure out where you're not in the research, so you can fill that space.
That's awesome. Wade has a question. Wade has a hand up.
Yes, hi. So Dr. Cooke-Jackson, is it, or is it just Cooke-Jackson? Okay, perfect. Yeah, so you mentioned earlier that one of the research, or one of the groups you were focusing on, were Black and Latino MSM. Is there a I don't know, rhetorical reason that you refer to them as MSM, or as opposed to, I don't know, Black and Latino homosexual men or gay men or something like that? Or is that just, a term of the trade?
No, I think that is a term that has been used for them, men who have sex with men. There's kind of a long history around that, so I don't want to go into that too much, but it is a pretty normalized term in the research literature. It is a normalized term. Most would say, again, among Caucasian males. It's interesting when you look at that word MSN, or men who have sex with men, in Black and Latinx communities. It is less accessible and they are less likely to use it. They would probably call themselves gay males because it's not a term of endearment for them. It doesn't really match up with what they see themselves as, and sometimes they don't want to identify as that at all. They don't want to even identify as a man who has sex with a man. But it is a pretty normalized term across the research literature. So it is what gets used the most, if that makes sense.
I see. Thank you very much.
You're welcome.
Stephen, go ahead.
Hi, Angela.
Hi.
I'm just over. I don't know if you're home or here on campus. I should make clear that I'm a colleague of Angela's. But a new one, and so I'm really curious about. First of all, I loved this. This is such a rich kind of set of things to talk about, and it's obvious that there's even more to talk about. One of the things that I'm curious about is the post project thing. One of the elements that's been emerging in my recent community partnered work is control, not just of the design and of the process while it's going on, but also dissemination of it. And so, for instance, in one grant right now with Indigenous collaborators, everything the team produces on sort of the scholarly side has to be read by the Indigenous partners. And if they say it can't be submitted for whatever reason, it can't be submitted, and they own it. And I'm just curious about your own experience with that kind of evolving practice on that side.
I think it is hard. I think community-based participatory design is long. It is, to me, very rigorous, but it is also very complicated by those kind of issues. And those are places where for me, I approach it and I respect that. And that can be frustrating. I'm also asking follow-up questions in that, how can we bring this out? How can we publish it? And in what can we publish it in? How can we story it? How can we give it poetry, whatever it might look like, that is more enriching for that group. Because to me, I feel that content needs to be, elevated by those group members. And I also feel like once I leave the community, I should have left the community more enriched and more empowered, and they should not have to look back to me and ask, like, what did she have us do? Like, why are we doing this? So I have a really deep hands-off approach, and I'm comfortable with that, because what I have found is over time, the things that I wanted to publish that I couldn't get published, like from eLeap, somehow it found its way out into the ether and out into the world. And it lives and it exists, and it's still impacting the life of these young folks that came to that program in the summer in some way. So for me as a researcher, sometimes there's that space of letting that go. And then working on those things that can be produced and created and put out there. But again, ultimately, I am very much hands off, and I'm like, that power lives in the community, and they need to feel empowered, not me as a researcher.
Yeah.
I don't know if that answers the question, but
yeah, no, that's great. I really appreciate that.
It can feel really, really frustrating. But I really did. I had to throw off my cape of research and say, this is for the community. And I oftentimes say to my students, in a very frank way, the community doesn't care that I'm Dr. Angela Cooke-Jackson. They want to understand that I'm there to, like, roll up my sleeves, roll up my pants legs, and get into the grit of things with them. And that's what I have to show. And so for me, sometimes that means I have to let go of all of that other stuff that academia says, tenure process says I need to have. Yeah. But I've always found that it manifested back in a really powerful way in my life. And that's just been about the journey. There's nothing else that I can equate that to. Is just like taking it slow, being meticulous, being on the journey, and letting the process happen.
Thank you. That was so wonderful. Unfortunately, that's all the time we have for this seminar. And Dr. Cooke-Jackson, that was such an awesome presentation. And I think all the audience members have made it that very clear in the chat. And, I really am grateful for your presentation today and for coming, talking to us. And we hope to have the chance to have you again in the future. Thanks to everyone for coming.
Thanks for all being here. I really appreciate it.
Definitely. Well, thank you, everyone. We'll see you next time.